My name is Catherine Volkent, and I'm the founder and CEO of Femtech Insider. Femtech Insider is an online publication, and we cover the women's health innovation system broadly. So anything from digital health to biotech to medtech, but also sort of the bigger players in the space. So pharma, personal care, consumer electronics, insurance. And then also a bit of sort of policy and research, because that's becoming increasingly relevant in the women's health space.
Amazing. So great to be able to sit down and have a chat here, because we've spoken at various things online and in person somewhere, I forget. But it's always good to hear about that journey for a number of different reasons. So I'm actually curious to understand where that came from firstly a little bit more, because it sounds like something that's probably evolved over time to then bring in more parts of the ecosystem. We know that health tech's quite diverse in itself, but then to niche down into the femtech side. Tell me a little bit more about that journey.
So my background is actually in tech. So I've spent my entire career working for tech companies of various different shapes and sizes. Yeah. And so what happened with me was I was actually diagnosed with polycystic ovary syndrome a few years ago. And so after the diagnosis, I was looking to innovation. I was looking to tech for, a solution or even just a tool to sort of help me make sense of this. Yeah. And I couldn't really find anything. And so at the time, I was in a fintech job, sort of, kind of looking at the intersection of finance and innovation every single day. And I really at the time was so surprised, and I couldn't quite understand why nobody was sort of talking about this intersection of women's health, reproductive health, and innovation at all. And so I started a newsletter and kind of evolved from there. And I started with digital health, because that's also sort of with my tech background, what I understood. And sort of as I learn more about the women's health ecosystem, so has our coverage basically expanded to now bring in all these other bits of the ecosystem.
Yeah, so cool. I'm sure we spoke pre-COVID too, that and seeing that evolution.
I think we spoke in the middle of COVID, actually.
Yeah,
I remember being in a pretty interesting Airbnb in Bulgaria.
I think I was in my laundry, to be honest, but that's
there we go.
That's what we did. Yeah. So, and what brings you to HIMSS Europe this week?
Yeah, I'm very excited to be here, and I'm here because for the first time, HIMSS is having a dedicated women's health track, and I get to be a part of that.
Amazing. And what's the kind of stuff you've been sharing with attendees today on that track?
So let me take a step back, maybe. So what I've heard here over the past couple of days is a lot of conversations about AI, and obviously, understandably so. It's kind of, the big elephant in the room to a certain extent. And I think what I'd really like people to understand and take away from the women's health track specifically is that when it comes to this conversation about AI, AI is really only as good as the data it's been trained on. And we're really missing a lot of data, specifically in the women's health space, and specifically when it comes to sort of conditions that impact women either exclusively, predominantly, or differently. So what that means is the women's health space has for many decades been under-researched or frankly just not researched, and we haven't seen women included in many very critical clinical trials. And so now, I think the AI is incredibly exciting, and the opportunities it offers in a healthcare context, I'm incredibly excited about. But we also, need to get the data piece right if we're going to make sense of it and make it, kind of work for 100% of the world's population, and not just those that happen to have been included in the clinical trials in the first place.
And it's a issue that, has been talked about a lot in different circles, but still obviously so much work to be done. I think about, though, this AI train we're on, it's certainly in motion, or at least there's a lot of hype and excitement around what's happening. It's not like we can prepare the data now to get ready for this. It's kind of like we're already moving. So how do we go about not backfilling, but in actually actioning some of these points that you're talking, these big gaps that we have in terms of actually ensuring that if there's AI solutions that are looking to address women's health concerns, that's got the underlying data to be able to do something that's actually effective?
So two things. I think the first part of this is going forward, let's make sure we don't continue on this path. But also to your question, I think sort of, going back is actually very interesting, because with a lot of trials that have been done, we actually have gender-specific data. We just haven't looked at it. And so I think there's a big hidden opportunity there to really sort of, actually go back and sort of, fix a few of the things that we've missed. And I think I would love to see more of that. And I think that's it's just, I don't want to say exciting again, but I think it's a very exciting opportunity for us to learn more and fill a couple of these gaps.
Yeah. And through all the work that you do and bringing different parts of the ecosystem together, are you seeing that there's traction? And by, I know from my own experience, by bringing together on the health tech side, the vendor community policy and everything, it can make incremental changes, but sometimes those small changes can be the little hinges that move big doors, right? So how have you seen by bringing the community together that there's actually been, some movement in this area?
So I've been running Femtech Insider for 6 years now, and sort of the evolution I've seen in this community has been incredibly fascinating and also incredibly encouraging. And, I think we are actually having this conversation now. So I think this in itself is already a big step forward, because in order to fix all the issues we have, we actually need to acknowledge them. And I think this is happening. And I think we're making steps forward. And, would I like these things to maybe happen a little bit faster? Yes. But I think, especially in the women's health space, let's not get discouraged by the speed of the change and just acknowledge that change is happening.
Yeah.
And that it happens maybe slowly and maybe not as fast as we'd like, but it's happening. And, bit by bit, I trust we're going to get there if we work together.
Yeah, I agree. And I think that often in these communities, it's important that there's a lot of different voices, but sometimes it takes those passionate individuals that are part of that community, and they don't need to be in senior executive decision maker roles. They can be the influencers up in whatever area that they operate in. But I have seen so many examples where individuals who are passionate and amongst a community and even sharing some of those smaller wins kind of gives hope to others that, hey, here's an example of success and traction, and having that community together sounds like it's really effective. So is there a global kind of contingent amongst the group you have as well?
Well, first of all, I couldn't agree more. I think, if you're passionate about something, start speaking about it, start talking to others about it, start finding the people that are passionate about the same things that you're passionate about. And I think sometimes we are not aware what a big difference we can actually have. Look at me. I was a patient that started a blog. And now, we reach 500,000 people every month with this message of innovation can really drive women's health forward and, kind of close a lot of the care and diagnostic gaps that we see that, impact women on every single day in the entire world. And to your question, I think community is incredibly important. It, kind of drives us forward. And I think diverse perspectives are at the core of the conversation. And I encourage everybody to always, kind of really take a very hard look at the community they're bringing together, and also think about who else do we need to bring to the table in order to, really represent everybody's voice to as much as we can.
Yeah. And I found too that by bringing together, you think about communities within digital health, it's not like they're in this neat little kind of quadrant of this one lives here and this one's here. And if anything, if that was the case, then they wouldn't be effective. It's great to see, that crossover with the HIMSS community here with the Femtech Insider side. So that's super important as well.
Yeah. So what we've also seen is that, and this is why spaces like this are so incredibly important. So, with regards to online communities, it can sometimes feel like you're more connected to other people's content than other people directly. And I think, kind of meeting people in person and, sort of just having a chat, maybe just having a water cooler chat over, a double espresso in the morning. I think it's incredibly effective. And that's, how real idea exchange happens. And, it's coming together and, really meeting other people in sort of your ecosystem, whatever that may be, can really drive change forward, in my opinion.
Yeah. I agree. Lastly, then, so it sounds like it's been a great journey in pulling the community together for Femtech Insider. What are you working on next? I'm just personally interested as for building community as well. It's always that difference between there's often a willing contingent of individuals that want to participate, but also the realities around it is it's got to be funded from somewhere and all of those kind of fun things too. Like, what's that next kind of 6, 12, 24 look like for you?
Yeah, I mean, we're actively looking for partners to have some more in-depth conversations also on Femtech Insider. We've done a lot of work around our online events over the past years. And, talking about it, I think in-person events are very, very interesting. And also, our community is kind of asking for it to a certain extent. We've run quite a few in-person events that were invite only, kind of curated, bringing people together. And I think we're going to continue to do that and continue to see what this in-person strategy for Femtech Insider could look like.